Hello, I'm Katie Parr. I'm an ultrasound tech. I'm sorry I'm doing this in my car, but I'm going to answer some of these questions that were sent to me. So, how long is ultrasound training? So, it depends on how long it takes you to get your prerequisites and get into a program. Once you get into a program, the program is typically 18 months to 2 years. What does an ultrasound tech do? Well, we do a lot. It depends on where you work. Everyone typically will end up doing some kind of work in a hospital at some point in their career. You will learn how, in school, you'll learn how to scan not just OBGYN, but you can also scan the abdomen and vessels, like the arms and legs and carotid arteries. You'll learn liver, kidneys, spleen, pancreas, all of that. It's not just the fun OB stuff. Okay. There is specific training, but you'll go do that in your school. They do not do just OB-GYN training for ultrasound. You must learn all of it. Cost of training, that all depends on where you go. I recommend going to an actual college for that. You can get student loans, you can get grants, you can get Pell Grants, stuff like that. And the cost is typically less than if you go to like one of those, they call them colleges, but they're not really a college. It's like technical training colleges, and that's all they focus on. That's usually where you're going to spend a lot more money on your training, rather than not. Plus, if you go to a college, you have a degree, not just a certificate. Where can you find them? Oh, a lot of the community colleges around here have it. I know Hill College used to. I went to Weatherford College. I think there's a couple in Fort Worth and there's a couple in Dallas. Again, I would go to a college and make sure it's a college that offers everything, not just the medical little training stuff, because that's not a real college. Let's see, what is your schedule like? Schedules depend on where you work. I have worked a lot in OB-GYN offices, so that is when you're scheduled to work during office hours. Typically not weekends unless you take extra jobs. If you work at an imaging center, it depends on their schedule. If you work in a hospital, it depends on what shifts you're hired for. When I worked in the hospital, my shifts were Friday, Saturday, Sunday, 12-hour shifts, 7A to 7P. So it depends on what you get hired for. They do offer PRN too. Let's see. Pay also depends on where you work. You're going to get paid more in a hospital and in an imaging center than you would in a doctor's office. You trade the pay in a doctor's office for the flexible schedule in a doctor's office, and the nice schedule in a doctor's office. Plus, if you work in a hospital, if you do different shifts, you have what they call shift differentials. So if you work nights or weekends, you get extra pay, holiday pay, stuff like that, that offices typically do not offer. My favorite part of the job, now I, again, work in OB-GYN offices, so one of my favorite parts is getting to see them, see how happy they are, show them the babies and stuff, and talking to my patients and bonding with them. I've been in one of my offices for going on 13 years now. I've scanned some people's, all the babies they've had. You know, I've seen them all through all their pregnancies, and that's a lot of fun. Let's see. Some of the struggles, especially in OB-GYN, the struggles are when you have miscarriages. Those are hard. And they're not always early term when they're small and you just pass it. Sometimes you have late term miscarriages where they actually have to go in and deliver the baby. My worst experience was when I worked in a hospital. We had someone miscarry, and they actually miscarried while they were downstairs getting scanned, and we had to pick baby up and put it in a biohazard bag for the lab. That was hard. Things to consider before you become an ultrasound tech are, it is a lot of school. It is hard. You do have to crack down and study. You do have to learn how to think differently, because everything you're scanning, everything on your left side of where your left is on your left screen is your right, is the patient's right. So you have to learn how to think backwards. You typically scan with your right hand and you work the machine with your left. So it helps if you can learn how to do that. And you will. That's just something that comes. Let's see. I think that's pretty much it. Good luck. Research more. Research your schools. If you can shadow somebody, that would be good. If it's something you're really considering wanting to do, if you wanted to shadow me on a day, you could come shadow me like on a Wednesday or Wednesday afternoon or something, at one of my OB offices. Or I also do 3D imaging on Saturday mornings. So you could get my number from them if that's something you'd be interested in doing. I wouldn't mind helping you out with that. And if you have any other questions. All right, thank you and good luck.